The parent paid provider program is, I think everybody's talking about it. We have a lot of new things that are happening around it. It's also tax season. I thought this would be a great time to have this kind of conversation. And who's giving advice? I am a mom to a 25-year-old, and I'm shocked that I've been in this community for 23 years. Like it is just flown by, and I feel like it's such a wonderful family of people that I've gotten to meet, and I love advocating. My passion is around access, ALTCS, health insurance. I'm an expert in Medicaid and Medicare. I think I heard you guys heard me say that I'm a Medicaid nerd, and I want to start a club of Medicaid nerds. I sat on the Governor's Advisory Committee where we reworked Medicaid for those with developmental disabilities, and we were on that. That committee was open for 6 years. We did like a ton of changes within the system. Obviously, there's a lot more to be done, but that committee was sunset by the governor. I'm also one of the 7 moms that worked on the autism insurance legislation in 2008, and we were able to pass that. I'm currently the president of Autism Society, and for my quote unquote real job, I am a licensed health and life insurance agent. So, what I'm not, I am not a lawyer. I am not a CPA. I am not an accountant. I am just giving you information that I've collected as a Medicaid advocate and having served on, I feel like, a million different kinds of committees within Mercy Care, United, DDD, Access. And so you're going to have to check with your own CPA, your own lawyer to confirm how you want to proceed with the information that I give you today. Paid parent provider program is actually something that's been around for quite a long time. Most people who were familiar with the program had adult children that they were participating in the parent provider program. So if you had a adult child with developmental disability, or you had an adult child that was part of the elderly physically disabled program, or you maybe had a parent that was part of the elderly and physically disabled program, and they lived with you, you could become a paid parent provider. And so that's something that's been around a long time, but minor children had always been excluded from this program. So it was something that most families didn't really hear about until they had an adult child. During COVID, we got some flexibility that we really had never had before. And so CMS, and that's the Center for Medicaid and Medicare, they came out with some temporary flexibility that the states could choose to use. And our state did choose to participate in this. And this allowed parents to become paid providers for their minor children. And this was really the first time in our state that we had ever allowed that. And the reason that that was done is because you couldn't find a provider to help within the home during COVID. And a lot of times, if you had a medically complex child, maybe you didn't want to have people coming into the home at that time. So it was really the first time that parents could be paid for attendant care and habilitation. There was no hour limit because it was so flexible. A lot of things were allowed that maybe are not going to be allowed in the future. So there was also 2 ways to fund the program, and that funding is going to be changing. So we're going to talk about that. So first, to qualify to participate in a parent paid provider program, your loved one has to have ALTCS. So if they have access and no ALTCS, this program is not available. So ALTCS stands for Arizona Long-Term Care. And so when we look at our Medicaid system, the umbrella of that system is access. And then underneath that, you have three programs. You have access for low income, you have ALTCS for the developmentally disabled, and you have ALTCS for the EPD population, elderly and or physically disabled. So when you qualify for ALTCS, what you're saying to the system is that your loved one is in danger of being institutionalized, and the program's goal is to keep that member in their home as long as possible. So when you qualify for ALTCS, you qualify for home and community services. And those services can vary and they're based on need. So through ALTCS, the paid provider program was a temporary program allowed under ALTCS because of CMS's flexibility, and that program has been extended to March 31st, 2024. So you might be wondering, okay, that seems like that's coming up pretty quick. And it is coming up pretty quick, but there's a lot going on behind the scenes, and we'll talk a little bit about that. So first of all, we have a waiver. So every state has a waiver. So Medicaid is a state and federal joint relationship. And so Arizona's waiver is waiver 1115. And you submit that waiver. So the state access submits that waiver to CMS every few years, and it's either approved, denied, changed, negotiations happen, and then that waiver is sort of the rule of law for a period of time until you resubmit again. So our waiver did not have anything in it that discussed the paid parent provider program for minors. So Access submitted a proposal to CMS to add the paid parent provider program for minor children permanently. We are still waiting to hear what CMS is going to say. They have it, they've received it, they've reviewed it, and everyone's thinking that we're going to hear something shortly from them. I think most people feel that CMS is going to approve it, but of course we can't say. We're waiting for them to let us know. The language that Access used may not be the language we would agree with necessarily. So what they said in their proposal is that these would be extraordinary services that a member might need, and that included attendant care, personal care, and homemaker services. Now, homemaker services, I'm just going to tell you that's the biggest joke I've ever heard in my entire life. I have never known a single human being that got homemaker services. However, I am told that this is going to be something that will be more available. I was going through the DDD policy around homemaker services yesterday with other advocates, because there is, DDD has put out the policy and asked for public comment. So we will be putting out public comment. We encourage families to pay attention to that and to feel comfortable in sharing their stories. We'd like families to wait until we release our statements, not necessarily because we want you to use our statement, but we want support for the statement and then personal stories that support what we're sharing, the feedback that we're giving. And when I'm talking about patient or parent advocates, I'm talking about a variety of organizations that are all working together to analyze the language. So stay tuned for that. We did a deep dive yesterday. We spent over 2 hours going line by line. And believe it or not, we were even debating punctuation because punctuation matters. And I just had a really hard time with the semicolon that was being used frequently. And I'm not a lawyer, but I'm constantly asking lawyers, okay, shall or will? What's the difference? Like sometimes I feel like they choose a word, and I'm like, I wonder why they chose that word. So it's an interesting process that we're going through. Habilitation was included in the proposal. However, I've had interesting conversations with people within Access, and I've been told by some of the Access employees who I trust that Access really viewed habilitation as not being a part of
Cynthia,
this
could you
waiver
maybe,
service.
and I
Mhm.
apologize for interrupting you, but
Yeah.
could you maybe give some examples of how we know what is attendant care versus personal care versus habilitation, like literal
Yes.
examples of those breakdowns? Sorry.
Yeah, no, I would love to because we had that conversation yesterday.
Cool.
So if you have someone coming into the home to teach your child to cook, that's habilitation. If you have someone who comes into your home to cook special meals for your child or adult, that is attendant care. So it's very close. Um, and and what can complicate it, I don't want to get too far in the weeds on this, is the definition of habilitation versus rehabilitation. Um, the state and federal government and private insurance, we're constantly debating these issues. I don't ever want to hear the words rehabilitation or habilitation and have to like have that argument again, but it does sort of sneak up still. So when we're talking about habilitation, that's really talking about teaching skills and developing skills, where attendant care and personal care and homemaking is really providing that care because that person can't do it. So there was some debate about home and community among lawyers too. So I've had debates with other lawyers, and I'm not one, even though I like to sometimes pretend I am. I dreamed I would go to law school, and I never just did it. But um, from the perspective of how I read it, home and community services habilitation is one of those services, so it could be included. Some attorneys read it and think that maybe it doesn't necessarily meet the requirement. There's sort of a debate, and who is gonna solve the debate? CMS. They're gonna decide exactly what they're accepting and what language they're gonna accept. And then based on that language, we're gonna have to make sure that policy and procedure within Access and DDD match that. So I think that's one of the reasons why DDD has that policy out for review. Everybody's sort of getting ready for CMS to rule. And I think most people believe that they're going to rule in favor of keeping this program. But again, we don't know until we see it. The other part of the proposal was that there would be a limit to 40 hours. So during the pandemic, there was no limit on hours really. There was two different kinds of funds, so you could use funds from one and funds from another, and it was a little bit messy. And so now that we're talking about a permanent program, Access put into the language that there would be a limit of 40 hours. And what's important about the 40 hours is it's the 40 hours follows the member, not the parent. So you can't have dad does 40 hours and mom does 40 hours. That's not how it's written. It's written that the member gets max 40 hours.
Can I ask
And
you
what,
when, oh,
go right
when
ahead.
you say, when you say mom and dad as an example, but there are also still other caregivers or other people being paid. Do they fit into that same 40 hours?
If they're a family member, and so a family member is being paid, then yes.
Okay. I just wanted to make
Yes.
sure it's not just
Yes,
mom and dad, it's also sibling or grandparent or.
correct. Absolutely. And then what is important, because we're going to talk about tax situations later, is when we're talking about difficulty of care income, which we are, difficulty of care income requires that you live in the home of the person that you're caring for. So you can have attendant care all day long and have someone outside the home provide that. But what we're specifically talking about is the parent paid provider program and difficulty of care income. And so there's some rules around that.
And then another question that just popped up is the 40 hours per service, or is that total? Like per habilitation, attendant care, or all of those services up to 40?
So we have to be careful because I'm not sure habilitation is going to be included or not included. There's some debate around that. So it is 40 hours of like all the services. That's how it's been explained to me. However, there is a service that's not grouped with these, and that is when you're and I forget what it's called, but you're a you're a licensed person who's providing, it was passed in 2019. So parents who need to provide nursing services for their child are paid in a parent provider program way. And those hours are completely different than the hours that we're discussing. So that's separate. And then some of this is going to depend, some of this is going to depend on what is happening with the policies right now. So like DDD just created a policy and they're asking for feedback, and it's like 22 pages. So that 22 pages would govern how the program would be implemented. And we had quite a few concerns about the language in that policy. And a lot of the language in that policy is more restrictive than the access policy. So a lot of what we're talking about right now is still within negotiation.
Okay. And I just have another question that popped up, and that is, just to clarify, is it 40 hours per month or per week?
No, per week.
Per week. Perfect.
Per week.
And
Yes.
then somebody else asked if this would be recorded and slides would be available. And the short answer there is yes. So
yes.
we will, we are recording and we will post it. So if you need to sign off, understood that this is a great conversation. So I'm sorry to interrupt, but thank you for clarifying those pieces.
That's fantastic. So now there's supposed to be a sliding reduction over a 9-month period to get people down to those 40 hours. I don't want to get too far into the weeds. I'm going to refer you to other people to walk you through some of that. We are definitely advocating for exceptions to the limit. And so, we're still in negotiations. So here are some important facts, and then I'm going to tell you why they're important. First, the hours are based on the assessment and the need of the child. So you are not guaranteed any hours at all unless you can prove a need. And so the assessment is a crucial part of that process. And I do know families have had issues with getting an assessment. I know that families have had issues with feeling like the assessment was subjective or not implemented in a way that they thought was fair. And we'll talk about that more in detail later. The hours are not based on the employment needs of the parent. So we really want to make sure parents aren't talking and advocating for this service based on the income that they need to survive. And then if you want to be the provider, you do need to work for an agency. You do have to fulfill all the training requirements, and you do have to clock in and out. You can interview a variety of agencies and find out what like the best fit is for you, for what agency, but you do have to meet all the criteria, even though you're a parent. You do not have to disclose to your support coordinator that you intend to be the provider. It's really none of their business. And so you don't have to disclose that. And I would argue that you shouldn't disclose that. Kind of the way I got into this community was when my son was 4, I went to a support group meeting, and I don't know, there was 50 people there, and my son had more services than anyone else in the room. And I was kind of like, well, why is that happening? Like, what's going on with that? And what I realized was that a lot of parents didn't know how to conduct a support coordination meeting. So some advice I would give you is you should read all the policies around the services that your child is using and the services that you think your child needs. You should use the language of DDD and ALTCS to justify anything that you're asking for. You should treat it like a medical record. So you should be constantly documenting things. So you don't have to be a nurse. You can be a parent and be documenting things that are happening. So I would document my son's maladaptive behaviors and then use those behaviors to justify the request for the service that I wanted. So it's really important that you look at it from that way. Like you have to look at it from more of a clinical need, and then make sure you're thinking about documentation, building a record, all of that. And then holding support coordinators and supervisors accountable. So when they say no to you, my thing was like, okay, that's interesting. I need in writing why you're saying no. And when you deny me, you're also required to give me an NOA, which is a notice of action. So I would request that in writing. A lot of times they didn't like to do that. If they say no and they won't issue a notice of action, just the no is a notice of action and you can address that. Whenever they say it's against the policy, I'm always advising families, great, can you send me that policy and can you show me exactly where the policy addresses this? And it would be helpful if you actually read the policy before they did, because a lot of times they can't find the policy because it doesn't exist. But it's important that you can reference that policy. So whenever I had an issue with Mark and getting a service, I usually included the policy with my email. So I'm asking for this.
I apologize, but I think it's in what you're talking about. We have a question that says, how do we find these definitions and policies and language? And I know that's right up your alley.
Well, let me just say this. It's not as easy as you would think, because every time I would find them all, I'd go back to them and they like moved. So it's like the hunt for the policy. And that still sometimes happens, but I am finding it a little bit easier. If you go on DDD's website, you can look up all the manuals. And then the other little trick that I like is you look up the provider manual, because sometimes the provider manual will have more detail about the service and how it's supposed to be provided. So that's helpful too. So just lots of making sure we're asking for things in the right way, and then we're documenting the need. And so if you can do things like, I'll give you an example, just thinking this way. So my son was doing OT and he collapsed. And so and then he was fine, but before we left that day, I asked the OT to put what she saw in writing to me. And then I took what she wrote and I gave it to primary care. And I am just here to tell you that when you have outside people who are witnesses to things, a lot of times you're taken more seriously than if you just the parent that witnessed it yourself. So whenever you have the opportunity of maybe something happening and someone, a professional, being able to validate what happened, make sure that you're asking for that, because it's just helpful. It's just building a medical record.
Okay, two more things, if I may. First of all, somebody asked, and I think the answer is this all applies to everything, but we started talking about paid parent providers for minor children, but I imagine that a lot of what you're talking about in terms of advocacy and hours and all of that also applies to adults. Is that correct?
Actually, it applies to everybody, correct? And I would add that what I saw with the adult population is a lot of times services would be cut, and what the supervisor or the support coordinator would say is, well, you only want that because it's a paycheck to you, your person doesn't need it. And they find ways to just really treat you poorly when you're the person being paid. And that's why, regardless of age now, right? Because we're going to see this behavior now in minor children. I've seen it with the adult population for many, many years. And so we're going to see it across the board. So
do you think there's any chance that CMS is going to adjust this policy and it'll also impact the adult piece?
So my understanding is the adult piece is staying exactly the same and is not even being addressed.
Okay.
So the only thing that CMS is looking at is for the minor children.
Okay, so the CMS piece and the advocacy work there is one thing, but also in your kind of suggestions about how we get additional coverage and, you know, the no's and the notice of action and that kind of thing, that applies to both, for parents advocating for both adult care and child care. Is that correct?
100%.
Okay.
And guess what? It applies when you're advocating for anybody. So my best friend was in the hospital over the summer, and I used these exact skills to make sure that we were getting what she needed, getting a second opinion, all sorts of things. So insurance works the same regardless of who the payer is. Medicaid can be more generous than maybe an employer plan, but the same thing is that you can't just have things because you want them, right? So you have to really create the record and the step-to-step to verify what the need is, and then to make sure that you have what you need so that you're not being discriminated against. You know, there's some great support coordinators. My son had the most amazing support coordinator, and she's still there, and I loved her. But you know, there's some that are not, and they're on a power trip, and you never know who you're going to get. You never know when you're going to have a change. And so it's just really important that you're careful about what you're asking for, how you're asking for it, and the documentation that you have to show the need, regardless. Okay, and then you have to decide, depending on the agency, if you're going to be an employee or you're going to be a contract worker. So are you going to be a W-2 or are you going to be a 1099? And so we're going to talk a little bit about that. But first, I just want to show you a text voicemail that I got from somebody a couple days ago, and this is what not to do. So this person basically called and said that they were told they could get $20 an hour for 40 hours a week. And they've kind of bounced from California to Arizona and then back to California. And so I think they're trying to figure out where can they get the best deal. I'm not exactly sure, but based on the conversation that I had with this person, they had no understanding of the system at all. I'm not sure where they were getting their facts. Their individual didn't have ALTCS, didn't have DDD, didn't qualify for the program, had a bunch of misinformation. And so we're talking about creating a fact sheet. So the advocates within our system are talking about helping each other create a fact sheet that we can use to educate families, both who live here and who are thinking about coming here, because we don't want misunderstandings. And we certainly do not want this kind of language, because this is the exact thing that's going to impact how we are seen by the system in a negative way, and we do not want that. So if you want to know more and you want to participate, Raising Voices Coalition, they are the ones who are really leading the charge around the parent provider program. Autism Society is participating and we're working on the project with them, but they are really the leaders. And so they're a wonderful organization. I encourage you all to check them out. They also have a Facebook page, and on that page, there's lots of conversations that happen that are very helpful. So if you want to learn more about this program, this is a great Facebook group to participate in. I highly encourage you to do that. Autism Society, we have newsletters, we have a Facebook page, we put out legislative alerts. Please consider joining us. We do classes, Autism 101, transition to adulthood, safety classes, all of that. So it's important to get involved, especially if you haven't been and you want to learn more about the program. The way that we learn the best is parent to parent. And the way that I'm a great advocate is parents calling me and telling me their stories. The stories that I hear from families are things that I could never invent. Like, I mean, they give such a wealth of opportunity to inform the system about how they can improve. And what I say to DDD, which probably not the nicest thing, but I'm like, just try to suck a little less every day. That's all I'm asking. Just make the effort to improve every day. Okay, so resources. So Access has some resources, and I want to direct you to the FAQs. Those are a little bit older, but they're still like a tons of great information. And if you use that QR code, you should be able to get to that. And then the other one, which is the Access one, that's their PowerPoint where they discuss the whole process that they're going through with CMS. And there's a lot of information there that I think can be helpful. Okay, and so how did I get involved? Well, I got involved in one way with them because we were advocating for this program. And I was happy to do that. And I wrote letters and, whatever, that was fine. But then what happened is Medicaid started unwinding. And what that means is during COVID, none of the states were allowed to kick anybody off of Medicaid. So it didn't matter what your income was. If you were on Medicaid, you had to stay on until they did the unwinding. So they've started the unwinding. It started, I don't know, 6 months ago, maybe even a year ago. So they were threatening to unwind in June of 2022. So they were giving people notices of like a 6-month notice because no state knew when we were going to officially unwind, but they knew it was coming. And then CMS and the government sort of kept changing the date. But in June, because I am an insurance broker, a lot of families contacted me and said, hey, we're getting kicked off of Access. And I need you to help me find a marketplace plan. And I'm like, sure, I would be happy to. I do that all day long. But then I'm looking at their income. And their income is too low. They should qualify for Medicaid. And what I discovered was CMS and the IRS do not agree with each other on difficulty of care income. And they know this, and they've known this for, I don't know, 10 years. And they refuse to address it with each other. So the IRS says difficulty of care income is not income. And CMS allows you to consider that income for MAGI, for trying to decide if you qualify for Medicaid. And to me, that seemed unfair. And so I started doing research and I can't help myself. It's just like an autistic trait. I think I just obsess and I go down these little rabbit holes. And so I became obsessed with difficulty of care income. I found every resource in the world that existed. And I wrote a letter to Jamie Schneider, who at the time was the director of Access. And I said, here is all this documentation. I don't believe that Medicaid should be using difficulty of care income as income when you're looking for whether a parent qualifies for Medicaid or not. And they said, that's interesting. Thank you. And nothing. And then I started doing research around the country, and there's a real conflict about how states view this. Most states will look at difficulty of care income as income for the means of deciding whether you qualify for Medicaid or not. Luckily for me, I know attorneys, and an attorney's word is always taken more seriously than a family member, in my opinion. And so the Morris Institute for Justice heard about my email to Medicaid, asked for a copy of my email and all of the documents that I submitted to them. And then they sent sort of a demand letter to Access asking for a bunch of information that Access, I'm sure, did not want to give them. And shortly thereafter, I was notified by Access that they were ruling in my favor and they were changing the rules around difficulty of care income, and that difficulty of care income would no longer count for qualifying for Medicaid. It wouldn't be viewed as income. Now, we're in 2024, and this was in 2022. And so you would think that this would be easy peasy. It is not. I'm contacted at least twice a month, sometimes 3 times a month, by a family who is being told that their difficulty of care income is income and therefore they don't qualify for Medicaid. I do have some really good relationships within Access, and I send them emails with the members' information, and I ask them to investigate. And so the problem is most of the entry-level Access employees, they're not familiar with the intricate parts of these policies. And this policy that we're talking about is very nuanced. It applies to very few people. And so when you just hit the regular person, a lot of times they're like, nope, done. So we want it to get to the higher level teams who understand it all. And then they reassess, and a lot of times they'll fix the issue. I never know if they fix the issue. So when people contact me, I forward that information to Access, but Access will never get back to me on what they've ruled or what's happened. So if families don't get back to me, I have no idea if it's been addressed, if it's been fixed. So sometimes it'll be fixed and sometimes it won't. And then families just need to contact me again, because sometimes Access just drops the ball and I need to let them know. But like no one, like you haven't given me permission to know your business. So Access is never going to actually let me know what's going on. Okay, so then let's just talk about difficulty of care income. So difficulty of care income has some rules around it. And again, I'm not an attorney. So you need to make sure that you read the language and determine how you think you qualify. But primarily it's home and community-based services through the waiver, which our waiver is 1115. And you need to be living in the home of the person that you're providing that care for. So if the aunt is living in a different house, that is not difficulty of care income. And so when they earn that money, that is income. So we're talking about a very specific, nuanced group of people. So it can be siblings, it can be other family members, it can be the aunt, but they have to be living in the home of the person that qualifies for home and community services and who they're giving that service to. That's the most important thing. And you can see on this slide the exact language that's used, and there's actually a whole letter that you can look at. Okay, so another thing is income tax versus employment tax. So difficulty of care income is not income. But if you're paid as a W-2 employee, they are allowed to withhold FICA. They can't withhold income tax, but they can withhold the FICA. If you are an independent contractor, you generally have no withholdings at all. Some employers won't even issue a 1099, some will. Some people are requiring that you submit a letter that says this is difficulty of care income and sign it. There's a little bit of a disagreement on some of this, and so you really need to talk to your tax professional. What I can say for sure is difficulty of care income is not income according to the IRS. And they can absolutely take FICA withholding if you're being paid a W-2. The reason I want people to think about whether they're a W-2 or a 1099 is because I just learned something that I never knew. And I stayed home with my son for many years. I was the higher earner in our family. And then when my son was diagnosed with autism, I ended up staying home with my son. And my husband went to work, and I did not work for many, many years. Well, I assumed that if I was ever disabled, that I would be able to get SSDI because I've paid into the system. I have 40 work credits, but that's not necessarily true. If you haven't paid into the system for 10 years, then you're actually ineligible for SSDI. So if you're, let's say, a stay-at-home mom or stay-at-home dad, and you're doing paid parent provider duties, it might make sense to have a W-2 to be able to pay FICA so that you're going to still keep that qualification for SSDI. Again, I'm not a lawyer. I don't work for Social Security, so I can't say for sure, but this is something to consider when you're trying to decide which agency you want to use and how you want to be viewed.
I would say you and I had a very recent popular webinar on disabled adult child benefits too. I imagine this factors into some of that game potentially parents are playing as well, and something to be considered in that
Yes.
arena. Is that fair?
Yeah, I think that's absolutely true. So I'm actually working, there's a Social Security certification you can take, and I am going to be doing that this year. It's very intense, and there's a really intensive test on it, but I'm dying to just drill down even more. But suffice it to say, if you haven't worked in a long time, you might not even qualify for SSDI, and that's something to think about and just to be aware of. Okay, so now you want to do your taxes. Now, I'm not going to tell you how to do your taxes. I hire someone else to do mine. I don't even pretend to know. What I can tell you is TurboTax and Tax Act are very familiar with difficulty of care income, and you can scan the QR code and it'll take you to their information on whether you're a 1099 or a W-2 and how that should be filled out. I have heard that H&R Block is familiar with it too, but I couldn't find anything online that demonstrated that, so I can't speak to that. And then Barry Dunn has some interesting information on that too. So I just give these 3 resources to you so that you can do a deeper dive into what you need to know for your own tax situation. And then here is the IRS information. So both of these take you to the IRS. So one is just the IRS letter that they put out, and then one is a FAQ that they put out. And so if you're going to have someone who's doing your taxes and you say difficulty of care and they look at you blankly, these are the resources that you're going to want to share with them so that they can read it and determine how that would work for your own personal situation. And then this is my information here. If you scan on my QR code, you can follow me. I have my own Facebook page. I have a Facebook group where I put a lot of advocacy information. If you are a parent and all of a sudden Medicaid is saying you don't qualify because of your difficulty of care income, you can feel free to email me I will always pass that on to Access, and hopefully they can redetermine your situation. I would have hoped that after 2 years we would be in a better situation with how some of this stuff is handled. But my perspective is that the frontline worker is really not educated in all the nuanced things. Our computer programs are like antiquated, and it's very difficult to add things in it. So the system just does a poor job when we're talking about unusual situations. So when we're talking about difficulty of care, when we're talking about people where the pickle rule applies, when we're talking about people who should not be paying their Part B or their dual premium, and then suddenly the system is charging them these things. These are things that are not supposed to happen. And at least once or twice a year, I sort of see a trend. And so from my perspective, it looks like they just hired a new employee and forgot to tell them about us and our special needs. So we have to keep our eyes on them because they can cause a lot of issues. So that's my information, and I'm open to talking more and answering questions and doing the best I can to help people.
Thank you so much. We have one question, which we may defer to an accountant, but let me just ask it. So, because it says, if you opt for W-2, so as to pay FICA, does that mean you're opting to pay federal taxes? I am therefore abdicating the hardship care employment benefit.
So I'm not an accountant and I'm not a lawyer, but I can guess. So my guess is that they take the FICA out, but they don't take the income tax out. And if you read the TurboTax or the other tax one, they kind of walk you through about which box to check and how to do that, and how to there's special codes that you're going to put in and things like that. So check out those resources, because I think they might address your question.
Perfect. And then please feel free to add more questions and answers here, and I'll try to address them. But I do also want to do a bit of self-promotion for mostly your opportunity to come talk to Cynthia about the disabled adult child benefits again. So we had such a good webinar last fall with tons and tons of questions that you and I are doing it again on March 8th, and we're going to do it both in person as well as virtually. So if you go back to our Eventbrite link, you can either get yourself a lunch ticket and come hang out in person with us and ask all the questions you want, or you can attend virtually. So I'd encourage anybody to do that. I've got another question here. It says, if I will file difficulty of care, will I still get credit with Social Security?
So that's the thing, right? If you're a 1099, then no FICA is being taken out. And so unless you have you're self-employed and you're paying in, I don't think that you will. I don't think so. So that's something to take into consideration.
Yeah, I think that's part of the whole game.
Well, and one other thing, like I didn't address, because I've seen conflicting things. So some people have lost SSI, meaning the parent has lost SSI because of difficulty of care income. And I'm not an expert on that. I'm more an expert on how it impacts your ability to qualify for Medicaid. But there is a wonderful person, Jessica, at Community Legal, and they were handling the Social Security issues around difficulty of care income. Let me see if I can find her. And also, when we're talking about whether you qualify for whether you qualify for food stamps or EBT or however they're calling it now, that income does count for that. If we're talking about Social Security, I'm going to defer people. Her name is Jessica. Her last name is Fiddler, Fidler, and she works for Community Legal in Phoenix. And Community Legal was doing a lot of work with Social Security and difficulty of care. So if you're having an issue around that, that's who I'm going to recommend, because they were doing the heavy lifting on that part. But if you're looking at, oh, they're counting it for my food, yes, they do, and they can, apparently.
One other question. It says, my understanding is that I will be taxed on the classes and sick time that I use from the agency, but not on my direct care for my son. Is that correct?
I'm going to defer to your agency, because seriously, I'm just a parent advocate. So I'm not 100% sure. It does seem that would make sense to me, though.
Yeah.
I mean, I did work in human resources, so I could see how they got there, but I'm not gonna assume I actually know what I'm doing in that area. And I would follow up with the agency.
Yeah, that would be my guess too. Okay, I'm going to leave the questions open for a few more minutes, but I did also want to bring something up in terms of kind of action and updates, and that is because yesterday our senator or congressman from Southern Arizona reintroduced the SSI Restoration Act at the federal level, which is something that we're not talking about today necessarily, but it is something that I think people should keep an eye on, because it's really going to impact a lot of SSI rules. And it's changing some very antiquated rules. And so I just would encourage everybody, when we send a follow-up email, I'll send some links to some information about it. But if you feel politically minded, it is something that you definitely want to reach out to your representatives about, because it's something that's really, really important on the SSI piece. And basically, it's going to update, if it can get passed, some of the income disregard and the asset limits for individuals on SSI. And so it kind of ties into this. And I just kind of saw that pop up, and I think it got reintroduced yesterday. But do you follow that?
We need that, because, I just wrote Anne an email, because I was looking at the pickle rule and then the pickle numbers. And it's like, it looks like the numbers are sort of being phased out. Like, I can see where the pickle rule isn't as protective as it was if you were using the pickle rule 5 years ago. And I am kind of concerned that the pickle rule is somehow being less protective. I have to do more research on that. But when you're just doing the math, it's like, wait, that doesn't make sense. So I wonder if that will be part of that. I have to look into that.
Maybe, but I know there's been a lot of issues as it relates to the marriage penalty and all sorts of things. So I think it's really, really exciting to see if we can make some progress in that area. We do have one or two more questions that popped up that you may have answers to. So the first one is, my son just qualified for ALTCS. Is there a place that lists possible habilitation goals?
Yes, and I didn't include it because I really want to encourage you to join that Facebook group that I showed you. They do have a goal library. And so that would be the place to go to.
Was that the Raising Voices Coalition Facebook group?
The Raising Voices Coalition, their Facebook group is the Parents Support Paid Provider Program.
Could you send me the link and I'll share it with everybody?
Absolutely, absolutely. Okay. And then the other thing I would say about that is, when you pull up the policy and procedure, and when you look at the policies from the provider handbook side, you'll get some ideas on what to use. And I want to encourage everybody, this is my own pet peeve. I want to encourage everybody to always have safety goals as part of that, regardless of age and stage. So if they're little, it's trying to be able to communicate where they live or their phone number. But we also need safety when they're online, safety when they're playing games online. We don't want our members lured. I mean, there's just so much that I think we forget to think about. And safety goals are much easier to get hours for than other things, because it's all about building a medical file of need. And when we're talking about safety, that's like one of the jobs of Medicaid is to keep that member safe. Like that's one of the most important things. So when you're looking at that, make sure you're always including safety goals.
And then there was a question, I was told we don't qualify for attendant care. Is there a place to check that? Or
I would love to know who told you.
Is it, she can get in contact with you then.
Yeah. Because if you were just told by a support coordinator that you don't qualify, then I would be going to the supervisor, because they should have done an assessment.
And she just answered my DDD case manager.
Okay, yeah. So again, if anybody ever says no, then the answer is why? Show me the policy, and I need that in writing. So I highly doubt, I mean, maybe she did. I guess I shouldn't assume, but if I had to guess, they didn't do the assessment. So without an assessment, they really can't make that determination. And again, I would also join the Facebook group.
Is there a limit on how many goals a person can have?
So DDD likes there to be a limit, because if they limit you, then you can only get so many hours. So the more goals you have, then the more hours you would have. And so, yes, they try to limit it all the time. It doesn't mean that it applies. And for me, so I should have stated before, I'm aggressive, so I'm not passive aggressive. People know exactly where so when I'm dealing with anybody within the state, I'm not rude, but I'm very clear about what I want, how I want it. And so I think when you're getting pushback on that, again, where's the policy that says I can only have that? Because I don't believe there is a policy that says how many goals you can have. So whenever you're hearing, I can't have something, really, you need to go back to the manual. If it's not in writing, it's not true.
Okay. Somebody thankfully clarified the Facebook group is called Parents Supporting Parent Providers in Arizona.
So. Correct. Thank you. And it's amazing. I'm a part of that group. They're a fantastic group, and they're really doing the heavy lifting. And so it's a great group.
And then I think you answered this, but I don't want to guess, but do you have to tell your DDD caseworker that you are the provider?
You do not.
Okay.
It's none of their business.
We got a very nice thank you for doing this. We're happy to do this, and we hope you found value in it. So I'll just say that. And then one last question. What if I have W-2? Will I still get 4 credits per year in the Social Security if I file the difficulty of care?
So the 4 credits are based on income that's declared, I believe. So FICA pays into Medicare and SSDI, but I think, and I'm not positive, and I'm not an attorney, and I'm not a tax accountant, but I'm guesstimating that since it's not income, it doesn't go towards work credits, because work credits are income.
I'm going to let you do the guessing, but there are resources that we can get you to if you need them further. Perfect. Well, I think questions are kind of slowing down, so we'll probably wrap up. Thank you. I've learned a ton today. Anything, Cynthia, you want to share or remind folks that they should take action on when they're working on these kinds of issues?
I'll just remind you that DDD does have a policy out there that's open for public comment, and we are all going to be making a public comment. So make sure that you're paying attention to that, because we definitely don't want a policy that's more restrictive than what Access's policy is. And then I just can't say enough. Read policy, procedure, make sure that you're versed on the services that you're getting and the rules around those services, so that you don't have any misinformation.
I love it. It's very important, and obviously a lot of people doing a lot of great advocacy work, but thank you for everything. Any final notes or anything? I just want to say thank you again.
I love talking about this stuff. Like I could talk about it all day. And I'll just point you back to the Raising Voices Coalition too, because they're doing a lot of great work on this, and Autism Society, and I'm just like a supporter. I'm participating, but I am definitely not doing the heavy lifting. The heavy lifting I did was around difficulty of care income and Medicaid. So that's what's so great about advocates in the state is we all work so well together and we all like each other so much and trying to just support each other and creating positive change.
Well, thank you for everything you do. And thank you to Ellie for being a great co-host in the back there.
Yeah, she really enjoyed it. Yeah.
Good. Well, for those of you who aren't joining us yet, hopefully we'll see you back in March when we talk about disabled adult child benefits again and more Medicare, Medicaid intricacies. And I'm going to go ahead and end the recording, but thank you again, Cynthia. And anybody that needs anything, please feel free to reach out to us. Talk to you soon.
Awesome. Have a great day, you guys.